Description and definition.
What is plantar fasciitis? Plantar fasciitis is one of the most common causes of heel pain. It involves inflammation of a thick band of tissue that runs across the bottom of each foot and connect the heel bone to the toes. The pain may be substantial, resulting in the alteration of daily activity. The term has been used to describe plantar fasciitis, including jogger heel, tennis heel, policeman heel, and even gonorrhea heel.
Incidence and prevalence.
Plantar fasciitis accounts about 10% of runner-related injuries, with some literature shows prevalent rates among a population of runners to be as high as 22%, occur in about 10% of the general population, and 83% of these patients being active working adults between age of 25 and 65 years old. Studies found that females present with plantar heel slightly more commonly than males. Plantar heel pain is the most common foot condition treated in physical therapy clinics, count for up to 40% of all patients being seen in the podiatric clinic.
Etiology.
First, we have tight calf muscle or a tight Achilles tendon. Second, ischiavus, which is very high foot arches. Third, leg length discrepancy. Fourth, splanus, which is flat feet. Next, we have obesity or rapid change in body weight. Sixth, impact or weight-bearing activities such as long standing and long distance running. Seven, improper footwear. And the last one is excessive training of exercise.
Clinical features.
The hallmark finding in plantar fasciitis is heel pain. The pain is going to be sharp and intense, where it commonly occurs on the inferior side of the heel bone, which is calcaneus. This heel pain is going to be mostly unilateral, meaning that one foot is affected and another one is not. The pain of the heel is going to be elicited with the first step in the morning or after you sat down and had a prolonged non-weight-bearing activity. It is because when you sleep or at rest, the arch of the foot relaxes. Then when you start to step, the arch will stretch. The pain slowly resolves with continued ambulation and weight-bearing on the foot, but as the day goes on and you continue to walk, stand and do exercise, the pain will loosen. Another important sign of plantar fasciitis, there could be also swelling of the heel and tight Achilles tendon. How do clinicians diagnose plantar fasciitis? The doctor will palpate the plantar medial calcaneal tubercle at the site of the plantar fascial insertion of the heel bone and it will cause pain. Doctor might also do the windlass test where the first metatarsophalangeal joint will passively dorsiflex, and if the patient feels the pain, the result is positive. Test is found to have a sensitivity of 32% and a specificity of 100% in diagnosis of plantar fasciitis.
Pathophysiology.
Plantar fasciitis is the result of collagen degeneration of the plantar fascia at the calcaneus tuberosity of the heel. Chronic overrest can lead to micro tear in the origin of plantar fascia, and repetitive trauma lead to recurrent inflammation and periostitis. The body initially responds to the inflammation, and cell called fibroblasts will make new collagen in an attempt to help with the injury. As the condition progresses over weeks to months, the inflammation diminishes and the collagen starts to unwind and unravel, and then it breaks apart and becomes fragmented. At the same time, the collagen is unwind and breaking apart. Fibroblasts are enlarging in an attempt to make more and more collagen, but the unraveling outpaces the new collagen formation. Many new blood vessels are made quickly in an attempt to provide more blood flow to the area, but these vessels are abnormal and immature and therefore are not very good at their job. The collagen that is created and added to the injured site is done so quickly and in a very disordered manner. The cell enlargement, poor blood flow, or collagen unraveling and disorganized new collagen all contribute to the thickening of the plantar fascia and pain.
Management.
There are many ways to treat this condition conservatively. Firstly, by putting ice on the heel, this helps to relieve the pain and promoting healing process. There are also oral anti-inflammatories like Advil and Motrin, which can ease the pain and inflammation of plantar fasciitis. Next is injection of steroid medication into the tender area. Can provide temporary pain relief, but multiple shots are not recommended because they can weaken your plantar fascia and possibly cause it to rupture. There are also special devices or tools such as supportive shoes or orthotics, which can help to decrease the pronation and decrease the mechanical stress on the plantar fascia. Next, splint, which is a rigid tool to keep the foot stretched out at 90 degrees while sleeping. Other special devices like walking boots, canes, or crutches are also used to keep patients from placing full weight on the foot. The other thing that really important is to do calf and Achilles tendon stretching over the period of time of treatment. This helps to increase flexibility of the calf and decrease some of the stress on the soft tissue. Not only that, there are also other conservative treatments that have been discovered recently, such as extracorporeal shockwave therapy or ESWT. Lastly, dry needling or acupuncture is also one of the treatments that used to reduce the trigger point in the muscles and stimulate muscle relaxation and healing.
For surgical management, we have gastrocnemius recession. Gastrocnemius recession surgery lengthens one of the two muscles in the calf. Lengthening one of the calf muscle can improve range of motion in the ankle. This enables you to flex your foot, helping the plantar fascia to stretch and relax. The procedure can be performed with a conventional open incision or with a small incision and an endoscope. Next, we have partial plantar fascia release. For this surgery, orthopedic surgeon partially cut the fascial ligament to loosen tension in the tissue band. If a bone spur is contributing to your discomfort, the surgeon may also remove it. This outpatient surgery may be performed using an open incision on the bottom of the foot. Another option is for your surgeon to use an endoscope. This surgery may take up 6 weeks to heal.
Prognosis.
About 80% of plantar fasciitis cases resolve spontaneously by 12 months. Although no mortality is associated with this condition, significant morbidity may occur. Patient may experience progressive plantar pain leading to limping, which is untarget kick, and restriction of activities such as walking and running. Changes in weight-bearing pattern resulting from the foot pain lead to associated secondary injury to the hip and knee joint.
Functional limitation.
Firstly, plantar fasciitis will affect gait pattern. Patient may change the way they walk to avoid plantar fasciitis pain. It might lead to foot, knee, hip, or back problems. Secondly, it will affect standing. Patient cannot standing for a long time. Patient will feel pain on bottom of foot due to prolonged standing. And the last one is limitation of range of motion. Full dynamic range of motion at the ankle joint could not be achieved due to gastrocnemius tension. So, in the conclusion, ignoring plantar fasciitis can result in chronic heel pain that hinder your regular activities.
Thank you for listening.